Las Delicias is a small community of nearly 3,000 residents located approximately 45 minutes outside of El Salvador's capital city, San Salvador. While the community is in close proximity to the Pan American Highway, it still struggles with access to basic necessities such as a constant water source and infrastructure like paved roads. Many of the residents of Las Delicias continue to work in agriculture, growing crops such as corn for their families and selling any excess for income. Mothers tend to cut coffee during the harvest, being paid a modest amount per kilo that is picked. Many times, the income that is earned from cutting coffee goes directly to school supplies and preparing the family for the upcoming school year. FIMRC began working at Project Las Delicias in 2008 to address the needs of the community and fill in gaps in healthcare services and education. We originally launched the clinic to serve pediatric patients, but have since expanded to include community members of all ages. Currently, more than 400 patients per month are being seen at our clinic. The main diagnoses in the clinic are upper respiratory infections, urinary tract infections, gastrointestinal issues, and asthma. Our public health outreach in Las Delicias is focused on the needs of the community. In conjunction with the health promoter, Morena, we focus on prenatal and postpartum care. Morena executes house visits to every prenatal patient on a monthly basis, providing home-based education and checkups. After the child is born, a series of visits also happen to ensure that both mother and child are healthy. Additional outreach efforts are a direct result of both community input and surveying that have taken place over time. For example, we lead efforts in the community to improve the potable water situation. In collaboration with FIMRC chapters, we provide water filters to families selected to participate in a health education program that leads to the distribution of individual home filters. We have also provided input into a project driven by Engineers Without Borders to increase water supply and ensure potable water to the entire community. We have also successfully solicited funds for the installation of a water filter within the community school to serve all children grades kindergarten through 9th. Project Las Delicias is also home to the world's first ever non-monetary health insurance program. The micro health insurance program was built to address the lack of education within families and the need for access to basic infrastructure to improve health conditions for participants. In the program, families earn health credits for actions, attendance, and successful implementation of healthy habits. These credits can then be used to purchase items necessary to improve health within the home. It is a holistic approach focusing on providing medical attention to participants, education, and supplies to improve health infrastructure. In the future, we only hope to continue to expand community outreach efforts and clinical services being offered. Las Delicias has truly welcomed us and made us a part of the community since 2008, and we look forward to continued progress and collaboration for years to come.